Hi, Dr. Glidden. Appreciate you taking my call. I have been suffering with high blood pressure now for 10 years.
Wait a minute, man. Hold on, buddy. How old are you?
I'm 30 years old.
You've had high blood pressure since 20?
Since 20 years old, I actually went in to the doctor because I was having dizzy spells.
Wow.
They would hit me kind of out of nowhere, and while they were taking my blood pressure in the office, it was running actually kind of crazy high, 150s, 160s over 110s.
Yeah, that's crazy.
Pretty regularly.
Yeah. And so did you get a cuff and do the thing at home, do the blood pressure thing at home, or did you ever do that?
Yes.
Yeah, and was it
Yes.
high when you weren't in the doctor's office as well?
It was.
Okay,
it was
good.
consistent.
All right.
Yeah.
Well, that's interesting that you should have this at 20 years of age. So you live in Arkansas. So when you were, 17, 18, 19 years old, what were you doing? Do you remember? Were you like a roofer or, an asphalt layer or a carpenter working outdoors a lot? Were you sweating a lot? Were you doing anything that made you sweat a lot, or what was your life like back then?
I've been an athlete and then played football since I was in third grade.
Yeah.
Straight out of high school, I had to work my way through college, and I worked in my dad's cabinetry shop, which was not air conditioned. So yeah, I did a lot of sweating.
All right. So do you understand where I'm going with this line of questioning?
Yes, I think I do.
Okay, good. So again, right, when you hear hoofbeats, you think about horses. There are a lot of things that can cause high blood pressure, but hands down, the most common thing, not making up numbers here, but I'm going to say over 80% of the time, is simple mineral deficiencies, especially calcium and magnesium. Your body just runs out of them, and then the blood pressure spikes. And, there's not enough of this stuff in the food anyway. And then if you're exercising a lot, you're sweating out your minerals. If you're working in a hot place and sweating, you're sweating out your minerals. And, it's the luck of the draw, right, depending on the food that you're eating and where the soil that it was grown in, as to how much calcium is going to be in your body at any moment in time. And after a certain amount of time, your body's going to reach a breaking point when it just doesn't have enough calcium, and then your blood pressure is going to spike. And then we're off to the races, right? Now, this blood pressure thing, from our point of view, of course, is a calcium deficiency. Check it out, man. There are over 278, I think, over 278 illnesses caused by not enough calcium. So I'm going to just throw out a couple of others, just randomly, and I want you to tell me whether or not you've experienced any of these in your life, okay? So restless legs at night in bed. Has that ever been a problem for you?
No, not that I'm aware of.
Okay, chronic low back pain.
Yes, back pain for sure.
Okay, any type of arthritis in your knees or your elbows or your ankles?
No.
And how are your teeth? Do you have any fake teeth or root canals or teeth that have been extracted or pulled?
No, perfect teeth. I've only had one cavity my whole life.
Oh, very good. And how about heartburn? Any heartburn?
Yes. Yes.
Okay. So, and what about the ability to fall asleep at night? Is it easy for you to fall asleep, or is that a struggle?
It's interesting that you say that because I've also struggled with panic attacks.
Well, there you go.
And that was about at the same time that I got diagnosed with the high blood pressure. I would wake up in the middle of the night in a panic, and what's funny and why I started seeking you and Dr. Wallach is I've been 10 years with medical doctors, and I'm on 2 blood pressure medications. I'm 30 years old.
Yeah.
I was in pretty good shape before I started going to these doctors. They put me on a beta blocker. I gained almost 100 pounds.
Yeah, it's crazy, right?
While I was on that. Yeah, and on top of that, started having panic attacks. So I'm a mess and looking to get better.
All right. Well, you've come to exactly the right place. Now, this is, remember, right, from the proper perspective, everything makes sense, right? I mean, if you look at the sun go around the earth, you think that it's the sun that's moving, but it's not. It's just a relative motion caused by the spinning of the earth on its axis. But if you didn't know that, you'd come to the wrong conclusion. Your medical doctor, not knowing anything about medical nutrition, comes to the wrong conclusion all the time. And, well, it's better to manage the blood pressure, and you haven't died from, a heart attack, so that's a good thing, right? But really, the sad state of affairs here, man, is that this is just a chronic amalgamation of nutrient deficiencies. And if your MD had a clue about this, years ago, you wouldn't be in the situation that you're in now. And this isn't like some big giant breakthrough that we just learned last week in medicine. We've known this for 30 years. I mean, we've known this for a long time, right? All right, so Jared, at at your body weight, here's the recommendation, okay? So first I'm going to give you plan A, because I have no idea what your budget is, right? I'm going to give you plan A, the optimal plan, and then I'm going to give you plan B, all right? So plan A would be, per month, 2 bottles of Beyond Tangy Tangerine 2.0. That's the peach flavored. Beyond Tangy Tangerine 2.0. 2 bottles of that. 2 bottles, I'm sorry, of Osteo FX Plus, 2 bottles of Osteo, O-S-T like Thomas, E-O-F-X Plus. Actually, I take that back. I always get this wrong. It's Beyond Osteo FX Plus. You have to put the Beyond in there. That's kind of important. 2 bottles of Beyond Osteo FX Plus, 1 bottle of Cal Toddy. That's C-A-L like calcium, Toddy, T-O-D-D-Y. So that's 2 Beyond Tangy Tangerine 2.0 peach flavor, 2 Beyond Osteo FX Plus liquid calciums, 1 Cal Toddy liquid calcium, 1 bottle of EFA like Edward Francis Albert at the 180 count. They make that in a 90 count and a 180 count. Get it at the 180 count. 1 bottle of EFA at the 180 count and 4 bottles of selenium. 4 bottles of selenium. Eliminate the 10 bad foods. Take those supplements every day. Measure your blood pressure every day. And within 4 weeks, there should be a noticeable downward tick in the blood pressure. There should also be an improvement in the low back pain, an improvement in the anxiety and the panic attacks at night, an improvement in the ability to fall asleep at night, and heartburn should disappear. It'd take about 14 days for the heartburn to go away, more or less. You also need to be salting your food so that it tastes good. That's very important. Don't worry about the relationship between salt and high blood pressure, because your medical doctors have their heads so far up their rear ends, they need colonoscopes to get it out. Don't worry about salt. You need to salt your food so that it tastes good. All right.